Hello, myself Dr. Shubhasati Das, child specialist. In this video, I will be discussing regarding diarrhea or loose motion. In this rainy season, I am getting a lot of children with loose motion, and their parents are in a panic state that my child is passing so much of loose stool, he is getting dehydrated. What should I do? And in this panic, many of them are starting some over-the-counter antibiotics and other antidiarrheal medicines. So I would be discussing on this topic. First of all, I would like to say that diarrhea is something which is a leading cause of hospital admission in children. It is a leading cause of illness for which a baby has to come to a doctor. So first of all, I would be discussing regarding preventive measures that you can take in this rainy season and also in other seasons by which you can protect your child from getting diarrhea. Number one would be hand hygiene. If your child is feeding by himself or herself, make a habit of washing their hand before they start eating. If they can use spoon or fork, it is better. If you are feeding a child, then you should wash your hand thoroughly before starting a feed. Secondly, I find many of the children having big nails and also mothers having big nails. So these nails are the warehouse of these germs. If the germ is there inside the nail, it will not go away by simple washing. And when you are feeding, this germ will come out from under your nail and go into the stomach and will cause diarrhea. Third, in this rainy season, when the population of germs goes up, you should be extra vigilant. If your child is small and he is in the habit of mouthing everything, then you have to wash the toys that he or she plays with every day. If he has just started crawling and he is crawling on the floor, then you should avoid or stop people coming into the room wearing shoes from outside. By these measures, you can help prevent diarrhea in your home. Now, once your child starts having diarrhea by some means, germs have gone into the stomach, and your child is having diarrhea, he is passing loose stool, he is passing very frequently watery stool every hourly, then it is a state of panic. But my advice to you is that even if the child passes 50 or 60 stools per day, you can manage it at home by giving ORS. When your child is passing loose stool, much amount of water from the body is getting out through stool. You have to replenish that water from outside in the form of ORS or normal water. ORS is always better. If the child is not able to take ORS, you can give water also. So if you are able to replenish the fluid that is lost in the stool through ORS, through oral feeding, then there will be no dehydration and the child will be active. With time, the diarrhea or loose motion will go away. So how much to give? For a 10 kg of child, you have to give at least 1 liter of ORS or normal water. If the child is 20 kilo, you have to give 1.5 to 2 liters, even above that. There is no harm if you are giving more of ORS. There is only harm if you are not giving adequate fluid. You can check that your child should pass one urine every 3 to 4 hours. If he or she is not passing enough urine and the urine is very high colored, he is not passing urine for 6 hours, and even if she passes, it is a very small quantity, then you have to think that your child is going into dehydration. And you have to correct that by giving more and more fluids, particularly ORS, normal water. You should avoid giving fruit juices or cold drinks or like that. Uh, Fruit juices has some osmotic property and it will increase the diarrhea. So give ORS, along with that some normal water. Now second thing that I come across is that some parents tell me that he or she is also having vomiting. So whenever I am giving ORS, he is vomiting it out. So this may happen in many of the cases with diarrhea. There is vomiting. So what we have to do is give the ORS in small quantity in sips. Use a cup and spoon and give 1 spoon and 1 spoon and 1 spoon of ORS all the day long. If you're giving ORS in small quantities like that at a frequent interval, then you will be able to give the adequate amount and there will be no vomiting. Now thirdly, I should recommend you to continue normal diet. Don't decrease the diet, don't change the diet, but if possible you can avoid some fruits and avoid milk if you feel that the milk and fruit are causing some more problem. Otherwise continue normal diet. Don't cut down on the diet. Cutting down on the diet will only harm the child. You have to continue feeding him or her normally. Even if he is passing many stools, you don't have to panic if he or she is passing one urine every 3 to 4 hours. Now lastly, regarding the wrong things that I find the parents are doing, like using some antibiotic from over the counter, giving this antibiotic at a wrong dose, wrong antibiotic in the wrong dose for a wrong period of time will only harm the child, will only make the antibiotic resistant, and in future when there is a disease for which these antibiotics are required, we will not be able to give it because the antibiotic has already become resistant. In 90% of cases, if you are giving ORS, it will be sufficient. Don't use any antidiarrheal agents. There are certain antidiarrheal agents which are available which can stop diarrhea, but if you use that, the toxins that have been produced by the germs inside the gut will remain inside and it will cause problems. So don't use this antidiarrheal or antibiotics by yourself. If you find that your child's diarrhea is continuing for more than 1 day, and even if you are giving ORS, urine output is good but the amount of stool is not going down, consult your doctor. Don't do self medication, but until you reach your doctor, try to give ORS as frequently as possible and try to monitor the urine output. If the urine is once every 4 hours, then you can be rest assured that your child is okay, and there will be no harm to your child even if he or she is passing 50 stools per day. So that's all. Thank you for patient hearing. You can post your comments below if you want to know anything more. Thank you.